cravings for alcohol, and that's sort of unknown why exactly that is. Antabuse for alcohol dependence is not really used terribly often anymore because unfortunately for this one, it essentially makes you feel quite ill when you drink and then use it. Sorry, if you take it and then drink. However, unfortunately, you can also die, so that is not a good solution either, usually. Rimonabant for obesity is just kind of another one of these blockers. There's also a medication called Campril, which is a novel mechanism and supposedly it sort of calms down some of the excitatory neurotransmitters in the brain, and there is some evidence for that being effective also. In all these medications, none of them are like a perfect solution. Most of them have like a 40 to 60% success rate at around 1 to 2 years, and patients who stop them then relapse. So you have to kind of be on them for them to be effective, which is a little bit of a duh. Like if you stop your blood pressure medication, your blood pressure goes up. Relapse, however, in this case is often associated with increased chance of overdose and death. And then once again, I make the point about blood pressure because I thought that was a good one. So I see patients experiment with this all the time. Like if I see the blood pressures up when I enter the room, the number one question I ask is, did you take your medication today? And these pills, just like blood pressure medication, they're not a permanent solution. It's not a cure to take a blood pressure medication. It's a strategy for changing your risk that day, essentially. And that's kind of a similar ideology. So, how long do you have to take these? And essentially, I think is still a lot more research to be done, but the most recent study, the most up-to-date things we have suggest that if you come off the medications, you relapse. So there was a study done on pregnant women with 101 women undergoing detox during their pregnancy. 40 of them were able to successfully detox, the others unable to do so. There were no adverse fetal effects, but only one of the patients documented to be abstinent was still abstinent at the time of delivery. So that's a pretty low success rate, right? That gets my attention. And then in other evidence of maybe you think well, it's only pregnant women who need to be on Suboxone.